marketing, branding, management, financial planning, and soft skills training. Topics in dentistry that has never been touched and never been talked before. Let's welcome Dr. Jashan Arora, who runs an academy and has an amazing Instagram page named as Dental Uplibrity Academy, where he trains a lot of dentists for soft skills, management, marketing, and branding. Let's welcome Dr. Jashan. So, hello, Dr. Jashan. Welcome to the podcast. How are you doing today?
Jesal, I'm doing good. How are you doing?
I'm doing great, Doctor. Thank you so much for accepting the invite and coming on to this podcast. And let us, start from your journey in dentistry. How did you get into dentistry?
So, dentistry was always my dream to be since I was in 10th or 11th.
Wow.
Before that, I wanted to be into the army, but because of my specs, I got rejected over there. And ever since, I always wanted to become a dentist. So, the journey, if I say it's not a easy one being a dentist, and initially, I've had a good number of struggles in my life having no experience in business skills and not having a good mentor in my life. It's not an easy journey, but it was a worth one.
Okay. Okay. So, in army, you said what inspired you to think about army, getting into the army.
So I was also a part of the Indian naval ship Hamla, which is present in Malad over here, and this I joined in the year sixth when I was in my sixth standard. So even over there, I was not selected so easily because I was the youngest one to join. My brother got selected, and I had cried during the interview. Okay, you have passed all the steps, but since you are young, you will be rejected. And I cried. That's unfair. You could have not taken an exam beforehand. After doing all the exams and people being senior to me, I passed better from them, and then you are telling me that I am rejected. So from there, the journey started. I went over there, and it was not a easy task over there either, but it was very, very fruitful over there. I mean, imagine being thrown into the ocean from a ship or a small boat that we used to take, and that's how we learned swimming over there.
Wow.
So that's where I wanted to join the army, and then it shifted when I got rejected because of my number. I moved ke nahi, if this cannot be done, I'll have to find some other way of helping the people, and that's how I came to medical line first,
Okay.
and then slowly and steadily I said I want to become a dentist.
Superb, superb. So I think I've gone through your Instagram. You're basically promoting and helping out dentists with the content which is more focused on marketing and branding. So how did you think of this idea? What inspired you for this thing? I should help people who want to get into marketing and stuff.
My Instagram profile is more of management. However, marketing and branding are very important parts of dentistry as well. The reason being, आज की दुनिया में अगर मैं market नहीं करूँ, so the life starts and ends at one place. Imagine you are the best dentist in the world, but the people not knowing that you are the best dentist. So who would want to come to you? I mean, I have the skills, I have perfect skills, I can do dentistry perfectly, but अगर मैं बाहर जाके पब्लिक तक नहीं पहुंचूं and not let them know that I am a great clinician, nobody would want to come to me. And that's where the entire marketing and branding skills come into the picture. अगर मैं वो नहीं करूँ, I am nowhere in today's world. So marketing and branding are very important and core areas of any particular business in the entire world.
Very true, very true. And if you see that currently even there are a lot of dentists coming up, I feel that marketing is one of the very important tool that you can use to stand out in the crowd. Yeah. So and see, running a clinic is not nothing less than having your own business, plus doing a service based this thing. So it's a beautiful merger of those two things. So how do you see, like, your dental clinic? Like, what are the certain things that when I'm putting a dental clinic, supposedly a new clinic, what are the tools that I should remember by?
Okay, marketing is not just generation of leads or getting new patients to the clinic. Marketing definitely in a short form is जो दिखता है वो ही बिकता है. However, marketing will not just help you to get more leads. It is in order to build trust. It's done in order to build credibility. So when I look at marketing, I see that most of the people in today's world, if they're using Instagram or any other social media for that factor, I've seen many people failing because of one mistake that they do. The mistake is they just try to sell.
Okay.
On the other way, what I see media as a place where I catch the pain points of my people and I try to help them. So for my industry is different because I am in a coaching industry on the Instagram. But if I see the dentists, I would like to catch a pain point of the patients whom we cater to. Something like pain which every person is fearful when going to the dentist. Use that as a USP. Start branding your clinic as a pain-free dental clinic, and from there start marketing and branding your clinic, and automatically you will start or reach a point where people come to you and ask you for an appointment because you are practicing pain-free dentistry. So I build trust, I build credibility, I build visibility, and slowly and steadily, automatically, these leads to patients or lead generation. So when I go to social media or any other platform, I would say my marketing or any dentist marketing should follow the Pareto principle, which says that 80% of my marketing should be such that it adds value to the customer. अगर मैं सिर्फ मेरी बात कर रहा हूँ तो भाई कोई नहीं देखने वाला है मुझको. So I have to speak about the customer, the needs of the customer. Accordingly, I start getting attraction. People start seeing me. Slowly and steadily, I build trust. And then comes to a factor where people start approaching you and getting treatments done for you. Marketing are of two types. One is where you reach the customer, and second is where the customer reaches to you. So the second one is called as magnetic marketing,
Okay.
because the customer comes to you like a magnet. So I would like to speak of two particular magnetic marketing, one of which you are doing rightly is podcast. The second one is a contest. So in a podcast or in a contest, what happens is the customer comes to you, markets for you, and this is the best form of organic marketing where you are not paying a dime out of your pocket. Your customer already has people who follow them. Your customers already have people who trust them. So because they are marketing for you, the trust factor is more. Now imagine if I put a feedback for a patient saying, "Here, say the patient puts a feedback for me, and then I take a screenshot, I go on to Instagram, I put it कि यार ये पेशेंट ने मेरे को ये फीडबैक दिया था." उसके बदले अगर मैं एक बिफोर एंड आफ्टर फोटो डाल के पेशेंट को सेंड कर दूँ, and the patient himself or herself put it on social media, this will attract more because the patient is doing it, not me doing it. Similarly is podcast in a contest where your customers are being called over an interview for a podcast. So if you're a dentist, you can call, and if you want to do a podcast, it does not necessarily need to be other dentists. If you're having a dental clinic and you want to grow the clinic, and if you want to use this medium of a podcast to attract more marketing, what you can do is you can call other business or other doctors or other people who have done splendid in other business fields.
True.
So you call them over if you know them, speak with them, create a podcast, put it online. this is how automatically you build a credibility for yourself. As far as the contest is concerned, if you have a contest और एक free चीज दे दिया है, so in order to get that one free thing that you are providing, your customer base goes out and starts putting it over stories, over posts, tagging their friends onto your posts, and automatically you get more reach. So these two ways of magnetic marketing are very important and should be done by a dental clinic.
Beautiful. So, in indirect marketing or the magnetic marketing that you're suggesting, word of mouth is the baseline of it, like, and nowadays, since people also have social media and everything, even them putting up is kind of a word of mouth, I would say. Like, beautiful, beautiful.
So what they are putting it is a digital word of mouth.
Yeah.
Initially, it was actual
word of mouth. Yeah.
Now, having said that, it's not a 1 day role, it's not a 1 month role. There are people who have struggled for years together in getting that initial followers. But remember, Instagram or social media is just like compounding in mutual funds. So initially, आपके पास पैसा कम है, तो you don't see that interest rate going up. Similarly, आपके पास followers कम है, so not many followers come in. However, with some time, imagine you have 10,000 followers and a 10% of 10,000 would be 1,000. At initial stage, you have just 200 followers, so 10% of 200 would be just 20. So once it starts compounding, you get the effect of marketing. So that's how I see marketing as.
Okay, beautiful. So, using just the social media as your tool, like what are the other tools that you would recommend apart from social media?
The first thing that I would definitely recommend is having your own website.
Okay.
And with the website, I would advise you to go for a search engine optimization, a Google business profile platform, and merging these two things in order to get more reach. Because आज की टाइम पे ऐसा तो नहीं है कि सोशल मीडिया सिर्फ मैं ही कर रहा हूँ. There are millions of other dentists who are using them as well. So in order to get that extra attention, or in order to get the major footfall to the clinic, I would say a dentist should primarily focus on search engine optimization and having the good website, because these things are going to be there in the long run as well. Because if you love Google, only then Google would want to love you back. Otherwise, Google is not going to show you at the top, nor are you going to get the results of marketing. So start loving Google, start having your own website. Go ahead and search engine optimize your website, and that's how you start generating better leads. Social media is a place to gather trust, visibility, but first thing would be the website, added with which your social media together would get you what you want from life.
Beautiful. So, for all the dentists out there, doctor, marketing and branding, like, are these two separate, or they have distinct differentiation? And what is the differentiation, at least when it is related to our dental clinic?
I'll break down into 3 steps: marketing, sales, and branding.
Okay.
So marketing is where I'm trying to generate leads. Matlab, marketing is not consultations. Marketing is I going outside, or my people going outside, or my profile working outside in order to attract customers. So this is a funnel from where at the top बहुत सारे लोग आएंगे, but till the bottom only a few are going to filter down and come to your clinic and get treatment done. So the funnel is a larger one at the top, and marketing will help you take people from the outside world and put them in a funnel where people start seeing you, noticing you, and you are being seen as a dentist as compared to the others. Now, from marketing to sales is when you are doing your consultations. This is where you are speaking with the customer, trying to understand what are the needs. आप यहाँ बेचने नहीं बैठे हो. अगर आप बेचने बैठोगे, again it's the same thing like social media. Nobody would want to buy from you. Until and unless they feel कि मुझे ये चीज़ चाहिए, they are not going to buy from you. So marketing being the step 1, sales or the consultation is the step 2, where I understand the needs of my customer. I help them by explaining what can be done in order to improve the situation in which they are. And finally they can choose. If they feel you are the right person, only then they will choose you. If they feel you are not the right person, it's okay, you can go ahead and find some other dentist. Don't take it at heart. ना आपने लेना चाहिए ना आपके कस्टमर ने लेना चाहिए. Move ahead, learn from it, understand the mistakes that you make. So even today, if a consultation doesn't go well, and if the patient doesn't say yes to me, I'm not over here feeding my ego and saying नहीं मैंने तो सब बराबर किया था. अगर मैंने सब बराबर किया था तो पेशेंट हाँ बोल देता मुझको. So I sit back. I have a recording of my consultations always been done at the clinic. I look at them. I find out the mistakes where I have gone wrong. I don't feed my ego. I help myself and make it a point that I improve later. So that's consultations. Coming to branding. Now, branding is, say, a Nike shoe. सो मार्केट में बहुत सारे ब्रांड्स है, मार्केट में बहुत सारे शूज़ है. वाई अ नाइकी, वाई अ एडिडास, और वाई अ स्केचर इज डिफरेंट एज कम्पेयर टू अदर्स? बिकॉज दे हैव ऑलरेडी बिल्ट अ ब्रांड, and brand would be built on how you give your service to your customers. If I look into phones, an Apple is a brand, a Samsung is a brand. So it all depends on the service that you are providing to your customers. So root canal is a treatment that I do. However, while doing a root canal, the service that I do or I cater to is making sure that the quality of the treatment is good, making sure that it's a pain-free experience, making sure that the waiting is minimum. नहीं तो कई बार ऐसे हो जाता है, the waiting is hours together and on the chair is just 10 minutes. So the entire thing is how you service or how you help them, how is the hospitality like, and all these things together will help you create a brand out of your dental clinic where people would want to come to you. And also create a story. Try to create a story behind your brand कि आप dentist क्यों बने, why are you doing this, how are you helping people. It's not just this, it's finally something else. So why are you helping people? If you try to add that story to your brand, and that's how the entire branding comes into the picture, and you become different from the others in the field.
Beautiful. So, even that you said the experience that plays a very important role since we are in the service sector. So, hospitality, and what are the few points, like, if you can just mention a certain things which will be very helpful for a dancer. So if they start doing this from tomorrow itself, the brand that they are creating will be of value, it'll be valuable. So just few tips if you can give.
So let's speak about the 5 senses that we have, and let's try to touch all the 5 senses of a customer when they walk into the clinic. So the first sense, I am not having any particular hierarchy over here, but let me just say the first sense is the eye. So when they walk into the clinic, they should see something which is hygienic, something which is looking good, something the ambience should be pleasant. It should not have a feeling कि भाई यार मैं एक hospital में आ गया हूँ, मैं एक clinic में आ गया हूँ. So from there itself the fear sets in. So the ambience should be such, when I look into the place, it should be good. The plant over here, when I see, it's a perfect thing for creating a soothing experience. There are many more things added to it. So I take care that the eyes should look at things which are clean. The ambience should be good. It should be soothing. Moving to the next sensory organ, let's say the nose. So when I walk in, and I get a common fragrance of eugenol in the dental clinic, that's not what a customer or a patient would want to. So as soon as they walk in, I would say touch this sensory organ by having a pleasant fragrance in the clinic, a very mild one, because there could be someone who is allergic to it and doesn't accept it so easily. So have a mild one in the clinic and make sure that you ask your customer if he or she is okay with it. If they are not okay, switch that mild fragrance off as well. The third one is the tongue or the taste. So when they walk in, when they sit on the chair, or say let's say before they sit on the chair as well, if you go to any shop, say a jewelry shop, you're buying a jewelry, even when you are buying that, they would want to offer you a juice or a cold drink or a masala chas or just plain water. So have those things present in your clinic. Offer it to them. So you are touching the sensory organ as well. You are being different from the others because finally it is how you treat them. मतलब ट्रीटमेंट की बात नहीं कर रहा हूँ, बट इट्स हाउ यू मेक देम फील. सो इफ दे आर कंफर्टेबल, इफ दे लाइक द एंटायर एक्सपीरियंस, रूट कनाल तो आई थिंक आज के दिन पे कोई भी कर लेगा, बट द एक्सपीरियंस इज वॉट मैटर्स. सो टचिंग द सेंसरी ऑर्गन बाय that thing, the tongue over there, and while they are on the chair using a mouthwash, because apne sare materials have a very sour taste to it, be it hypochlorite, be it just the luting agent or the fixing agent, it has a very sour taste to it. So in the end, you don't want your customer to move away with that flavor. Add a mouthwash to the water, make it an experience ki bhai, I know the taste is not good, go ahead, rinse it off, you will feel better. So that's the third sensory organ. Speaking of the skin, the touch. So touch is something which is very delicate, something which if you don't do rightly can be taken wrong. So how do I take care of touch at the clinic is, say if there is a male patient sitting or if there is a female patient sitting over here, accordingly the same assistant is standing over here at the side, and just when I am anesthetizing this particular person, this assistant slowly and steadily कि भाई मैं हूँ, you are not alone over here, मैं हूँ आपके साथ, don't worry, we are over here and together we'll take it ahead from here. And lastly is the ear. So a soothing music present around in the clinic, and it will help you in distracting the person from the injection or the experience or the root canal that you're doing, and distract them to the music. Multiple times मेरे clinic पे ये हो जाता है कि I start singing while doing the treatment, but then I tell the customers as well कि गाना सिर्फ मेरे लिए नहीं है, आपके लिए भी है. So make it a point that you tend to look at it, tend to keep an ear over it, keep the volume a little higher, because when the turbine starts, that volume decreases. So the volume should not be so high कि वो nuisance लगे, but it should not be so low कि turbine के सामने उसका आवाज़ ना आए. So all these 5 things together and you are different from the others.
Beautiful, beautiful. So in this, while we are talking about marketing and branding, the technologies that we can use, whatever, now in dentistry there are so many things coming in, even like a basic OPG, just an IOPA, a digital IOPA. There was a time when it was a new thing, now it has been going back. So should we update the technology and brand those things as well? So how can we do that, if you can just put some light on it?
Okay, you spoke about RVG. Let us speak about scanner because it's today's world now. So similar to RVG, when it came into the market, not many people were having it. People were skeptical initially as well कि वो dip ही better है. I don't know how would this perform as compared to the dip. I'm very comfortable using that thing. This is costly. Why should I buy it? Similarly, आज के time पे scanner है. People are happy with their old manual technique of impressions. They're like, why should I do this? It's so much of a cost. Why should I add so much of money? अगर मैं monthly अगर expense देखूँ तो मेरा rubber base or my A silicone would still not be so expensive. So why should I do this? Now this is a very fixed mindset. This is not a growth mindset. If I want to grow, if I want my clinic to expand fast, if I want that the customer should select me easily, you need to invest in technology. So buy a scanner. अगर आपको ऐसा लग रहा है कि scanner initial days, yes, they were more expensive, but abhi if you see there is with the competition, the rates of scanners are coming down. So buy in a scanner, invest into it, and show it to your patients. तो मतलब मैंने use किया और ख़त्म किया ऐसा नहीं है. So whilst using it, I would let my patients know that you know what, this is a scanner. Back in those old days, we used to take those impressions. So with this, the need of impressions have reduced or is stopped. You don't need to depend on those clay materials being put into the mouth. This will record and more accurately record the impressions. The plus point more to it is I don't need to wait for a person to come to my clinic, pick this particular thing, take it back. And with my lab, which is present in Surat, and I being in Mumbai, I have one particular day that could have gone if I deliver it. So with this, that one day is also saved. To more to it, there are some dimensions you cannot see in the mouth. You don't know if you have prepped the tooth rightly, if you have under prepped, you have over prepped. You cannot see it in the mouth at some particular angles. So a scanner is a place where you can accurately see if the dimension is enough, if you need to do more, or if you have already done more. So this is a place where you can stand different as compared to the others by showing देखो मैंने इतना prep किया है. I want to be more conservative. I have a scanner. I'll take one more scan if required, but I'll make sure I'll not over prep the tooth and show it on a digital screen, on a bigger screen to your patients, and they're like, oh wow. And मुझे ऐसा लगता था कि इससे क्या फ़र्क पड़ता है. इवन आई यूज टू फील कि भाई मैं टेक्नोलॉजी खरीदता हूँ बट मैं क्यों एक्सप्लेन करूँ मेरे पेशेंट्स को, जस्ट यूज़ इट. But after explaining, I had this one patient just completed some 7 or 10 days back. Her name is Vaishali. She had come with a ill-fitting crown on the lower right. We advised her a change of the crown. She opted in for a zirconia. We called the lab. We got the scanner. We got the scanning done. The scanning was sent. The cap got fitted. And this particular patient, I did not ask for a feedback. Okay. But this patient was so happy with the entire process. She went home, she ate food with it. There was no food sticking. She went online and she gave me a feedback. तो जहाँ लोग मुझे पूछते हैं कि भाई फीडबैक कैसे लेते, पेशेंट तो फीडबैक लेते तो भाग जाते हैं. They don't want to give feedbacks. This was a scenario where the person readily approaches us and gives a feedback even without me asking. So मैंने उसको ना टेक्स्ट भेजा है, ना मैंने उसको लिंक भेजा है. Clicking on the link and giving a feedback is still easier.
Yeah.
इसने खुद से ढूंढा. She went to the review section, gave a good review, and in the review she mentions that he is using the best technology, which helped me and the entire process become a very smooth journey. So technology ke bina you cannot grow.
Yeah.
So that's the factor.
And it's very important to even like talk about the technology, like communicate to the patient. So here we come to a certain set of skills which are not taught to us in the dental schools, and I highly recommend actually they should start teaching. That is something called as soft skills in dental clinic. What is your opinion about this?
I am a soft skills trainer as well. I have completed my soft skills training. So soft skills is very important because I'll just take it in a very simple way. I'll explain it not towards dentistry. I'm at my home. I'm newly married. My wife, me, we know each other since ages. But after marriage, you are in one room, you are at one place, and the communication needs to be improvised. I was not so good with my communication in the initial days, and that is why my wife faced many challenges with me. And then slowly and steadily, I understood that no, it's my communication which is at fault. What am I doing is not at fault. Yeah. But the communication was not 100% up to the mark, and that's how the entire problem starts. So communication is so important core in any relationship. And if a person who knows you needs communication a patient is somebody who doesn't know you as much.
Yeah, will require
उसके साथ तो ऐसे होना चाहिए कि भाई मैं चालू है, चालू, द मशीन इज कंटिन्यूसली रनिंग, आई एम कंटिन्यूसली स्पीकिंग, letting them know that this is important. To add one more factor over here, I have had a very good implantologist by the name Dr. Himanshu Manudane coming to me. So this particular guy, I've seen him doing two things while he is doing his treatment. He is placing implants at my clinic or at any other clinic. The one thing is communicating that what is the step being done currently. So this is bone graft. Right now I'm putting bone graft. This is how your implant looks like. देखो ये अभी मैं अंदर प्लेस करने वाला हूँ. Then he does it. Then he is stitching it. He's continuously explaining why are we doing all these things. And the patient is like, oh yes, अच्छा इसलिए though cannot speak but I can see that okay. And then the last thing, just before the patient leaves, once the treatment is done, the suturing is done, he doesn't give the post operative instructions. We take care of that. He said, you relax now. But the last thing that he does is after the treatment he tells to the patient, नहीं आप बहुत cooperative थे, you did a fantastic job because of which आपका treatment अच्छे से हुआ. Now I have seen that even if a person is not good on the chair, he will make sure that he says it. The next time this patient comes for the second implant, he or she is a much better patient, sits quietly, does the treatment quietly, praises the dentist, and is happy with everything that is done. So the communication is where the entire game changes. So what I do is I not only learn communication, I see others as well communicating, because डेंटिस्ट्री में ऑब्जर्व करके बहुत कुछ सीख सकते हैं. एंड सिमिलर इज कम्युनिकेशन. सो आई ऑब्जर्व अदर पीपल कम्युनिकेटिंग, आई लर्न फ्रॉम देम, आई इम्प्लीमेंट इट एंड आई ग्रो. सो कम्युनिकेशन is the core and most important ingredient of a successful dental practice. So yes, soft skills do matter.
Okay. Going forward from here, doctor, communication, like the skills that we discussed, any soft skill which can be trained within you, or some books if you would recommend, like to read so that your soft skills are developed.
I'm not the best person to answer about books because I myself have gone into academy and learned from there. They themselves gave us notes, and then we would go over social media or Google and search for more information. There are multiple books. I don't remember a book. There was one which I did read, but right now I don't remember those books, so I would not be the right person to answer this.
So in dental clinic, your staff plays a major role. And how does communication with them or training your staff, what kind of importance does that hold, and how to do it?
So I'll speak on both the factors, the training and the communication. So I just yesterday I had been to a clinic for a consultation where I'm there on the right hand side of the patient. The patient is on the chair, and on the left side the dentist of the clinic wants to see what is going on. So he or she is standing over there, and as soon as the staff does some mistake, the voice over here goes on to the top, like ऐसे थोड़ी बोलता है, ऐसे थोड़ी करने का रहता है, कितनी गलती करते हो तुम लोग, तो कुछ करते नहीं हो, लाओ मैं ही करती हूँ सब कुछ, दो मेरे हाथ में. So this is not the communication that I would want to see. What I see this as, देखो कस्टमर तो आपको कुछ बोलेगा नहीं, वो निकल जाएगा, बट इन द माइंड he or she has already framed an image of the dentist or the type of human that you are. And this is where communication came into the picture. Had the same thing been spoken in a polite way, अच्छा ये गलती हो गई, ठीक है कोई नहीं, ऐसे मत करो, मैं बाद में बताती हूँ कैसे करते, लाओ मुझको दो, फिलहाल मैं करती हूँ, बाद में आप लोग कर लेना, हाँ, give it to me. So being polite is utmost important. Your paying your staff, that doesn't mean you own them. Similarly, when a patient pays you, they don't own you. Imagine this being rude towards you.
Just because they are paying.
Similarly, if you are being rude towards your staff, it would not be easily accepted. And that's when the number of staffs keep changing and you don't realize what is going wrong. So when people tell me, Jashan, this is not motivating to me, so I am not a motivational speaker. I am a person who will give facts to you. Change is going to be difficult. Nobody likes to change, but if you see and if you do it, it's definitely going to give you better results. So rather than feeding your ego, एक जशन मुझको ऐसे बोल के चले गया, rather sit over it, understand it, because even I'll be very polite when I speak about it with you. I'll be very polite. Sit over it, understand it, make a change, see the results. Now, if you ask me how important is my staff or how important are my staff to me, my staff is my world. I cannot do dentistry without them. Because अगर मेरा ट्रेन स्टाफ चलेगा, नया आएगा, मुझे ट्रेन करना पड़ेगा. Rather I have my old staff with me. If they would want to go sometime, that's normal. कभी ना कभी कोई ना कोई जाने ही वाला है. जिंदगी में कोई भी रिश्ता जिंदगी भर नहीं है. ये भी रिलेशनशिप यहाँ ब्रेक होगा, इट्स ओके, दैट्स नॉर्मल. बट I cannot live without my staff. I have to train them, I have to make them a better person, and it's a teamwork. And teamwork मतलब आज मैंने बोला ये महीने में ना 10 फीडबैक लेने का है. So that's not a teamwork. Teamwork is where I tell to my patients, even after they give me an instrument, I say thank you to them. I say thank you. Like one of my assistants who is new to me and has joined from Sada Dental Clinic, like thank you क्यों बोल रहे हो, ये तो मेरा काम है. तो बोला तेरा काम है, मैं मानता हूँ बेटा, बट तेरी चॉइस भी तो है, तू नहीं करेगी तो that's your choice if you don't do it. So you are choosing to do this, you are choosing to work with me, you are working efficiently. And more so, to add more to it, not just a thank you, what happens is many a times when patients make a mistake, we make it a point, we tell the mistake to them so that the same mistake is not done again. But what when a good thing is done by the assistant or the associate? Are we still saying them a good or a positive word? You know what? Shabash, तूने अच्छा काम किया, so that the same thing is repeated again. This is being missed out. So communication again comes into the picture. Speak with them nicely. Speak with them politely. Give them feedback. Criticism is also required, but it should be done in a very polite way. Don't just go outside and start speaking like yeah. Don't yell at them. And I've had dentists who yell in front of assistants, in front of the patients as well. And I remember when I was in my initial days of dentistry, first year or second year, and my father needed a root canal, and we had gone to some dentist, and the dentist shouted on the assistant. I came back home and like, did she or did he speak nicely to that staff? And my father said, तू खुद भी ऐसे हो जाएगा. Become a dentist, become successful. Let's see how life turns up for you as well. So again, my father was like, आईना मुझको दिखा दिया कि यार ऐसा होता है life में. So rather than feeding my ego over there, I said, नहीं ये गलत है. I am learning from this, and today I have in a stage that I don't yell to the staff at all. My staff is someone who would want to work with me. I've had staff who have worked with me for 5 years, 6 years, where on the other side I have friends and dentists who call me and saying, यार हर 6 महीने में स्टाफ बदलना पड़ता है, अब तो मैं सब कुछ खुद से ही कर रहा हूँ. तो don't fall into that self-employment trap. Don't do that. And people tell me कि यार वो ट्रेन करो, वो साइकिल पूरा, and then they learn everything, they are good, and then they leave. मैं तो मेहनत नहीं करने वाला. So my father, he was a manager in an engineering firm. So he sat with his boss and he said, you know what, we have 1,000 employees and we need to have a training session. We'll have a Saturday, Sunday off. We'll take them to an outing. We do the training over there. We send some time together. So it's a get together with a training session. Let's go for it. And the boss asked, how much of money will this cost? So my father replied, 40-50 लाख जितना जाएगा. तो my boss said, नहीं, मैं नहीं करने वाला. बोले क्यों? बोले 40-50 लाख इन पे खर्च करूँ. I train them. And what if they go away to some other office, start working over there? मेरा पैसा तो down the drain गया. To which my father replied, like, agreed, completely agreed. But what if you don't train them and they stay with you? Imagine the
That's
problems.
a bigger, yeah.
That's a bigger challenge that you are going
Yeah.
to face. So rather than putting yourself in that scenario, you train them. People are bound to go, they will go. So train them. Team is important. Without team, मैं अकेले मेरे लाइफ के गोल्स नहीं अचीव कर पाऊंगा. टू ऐड वन मोर पॉइंट, I also go beyond and help them achieve their goals in life.
Wow.
Because that's when they want to come and help me achieve my goals. So sit with them, understand what their goals are. One of my staff back in 2016 had told me, I want to purchase a car. I said, okay, sit over it. Let's come to a point. Which car do you want? When do you want? How will you work over it? Let's go ahead. We'll help you to achieve that. So this is how, when you help them, they would love to help you. So this is teamwork.
Wow. So I think there is a perfect segue to our next topic in this thing, Doctor. Something called as financial planning. Like, as we all know that we are all biology students. Mathematics is something that we have left long back, like, while you're practicing. So we always face challenges when we come to the point where we are supposed to financially manage. And what are the factors that you look into it, and how do you do this part?
A very easy way that I take care of it is, I understand that all the money that flows into the clinic is not mine.
Okay.
Some belongs to the staff, some belongs to the lab, some belongs to the materials, some belongs to the rent, and then what is remaining behind is mine. Now I take it in a different way. So say if I have an X amount that comes to the clinic, I keep some part as mine, and this is my salary. So I pay myself first. Once that is taken care of, what I do is I segregate the other money that comes into the clinic, into rent, into staff, into material, so that once I know that this is being segregated, this is not mine now. And at the end, when the lab bill comes to me and says, sir, आपका ये पैसा आपको मुझे देना है, I know what that amount would be, because once one person confirms, once the treatment is over, I know इसका ये कैप किया है, इसका ये अमाउंट आने वाला है. I segregate it. If it's in cash, it's in a different envelope. If it's online, if it's in FD, I segregate it. At the end, just close the FD and pay the lab person their fees. So at the end, it doesn't go out of my pocket. नहीं तो होता ये है, keep the money comes, I put it, I go outside, I spend it, I buy something, I don't know मैंने कितना spend किया है, I don't know कितने expense आने वाले, I don't know what is remaining, and at the end, everything is over. And like, oh God, अब मैं रेंट कहाँ से भरूँ, मैं लैब बिल्स कहाँ से भरूँ, मैं EMI कहाँ से भरूँ. So accounting and segregating is a very important factor. Keep your accounts neat and clean. Sit with your accounts team. If there is no account team, I have trained my staff to become an accountant as well. So what she has to do is, we have a software that we use. Just feed all the data into the software. At the end of the week, take a printout. This is the weekly collection. Hand it over. Sit with us. Understand where are we, and make goals for the next week or the end of the month according to how the scenario is. So when you do this every month, every week, so once a week and then one bigger meeting at the end of the month, you understand where are you sitting at the end of the month, and accordingly you can make decisions so that not only you grow, your team grows, and you understand that if dentistry is working for you, helping you, feeding you, or is not able to feed you.
True, true. Beautiful. That's like a perfect segregation out there. So, Doctor, next thing that I want to put some light on is networking within your own field first, and networking socially, so that people, like, you can attract more and more patients. So these two, networking and like, how important are they, and how do they play an important role in our professional life?
First is internally with our associations or with our dentist fellows as well. So the most common thing, or the first thing that comes into my mind is the Indian Dental Association. So it's a very sad fact that people don't want to join the association, and they ask me कि association join करके मुझको क्या मिलने वाला है. But I don't look at it that way, and nor would I suggest any dentist to look at it that way. I look at it is association से मुझको क्या मिलेगा, नहीं, मेरे से association को क्या मिलने वाला है. So what can I do for the association? Because dentistry is not the entire life, it's a part of life, and in this part of life, if you add help to the association, I've been a good committee member of the Indian Dental Associations in last 7 years. Currently also I am a part of the committee as well. So I have always given it back to my dentist friends. ऐसा नहीं है कि मुझे यहाँ पे मैं इस दुनिया में आया हूँ तो मैं सिर्फ लेने आया हूँ. I have to give it back to them. And when I go and give back, the satisfaction that you get is unmatchable. You go home being a better person. Dentists know you कि यार ये लोग ने कितना अच्छा ऑर्गेनाइजेशन बनाया, कितना अच्छा कमिटी बनाया, कितना अच्छा लेक्चर रखा, or whatever it is. So what happens is, at the end, the association is benefited, and if the association is benefited, definitely the dentist will be benefited. So don't look at associations like what association gives you. Look at it like what you give to the association. That's what internal association is all about. Everybody should be a member of Indian Dental Association. I have not seen a CA, a chartered accountant, who is not a part of the Association of Chartered Accountants. It's not allowed. It's not allowed. How can a dentist have or live a life being outside the association? So Indian Dental Association is a must. So 2016 or 17, when I joined the association, I remember I transformed my life from there. Things started improving, things started becoming better. So if I can do that, why not you? So that's the internal association. And outer association, let us understand networking. लोग को डर लगता है ये वर्ड से. पीपल फील यार ये क्या है नेटवर्किंग, मेरे से नहीं होगा. ओके, इफ़ यू डोंट हैव टाइम, आई अंडरस्टैंड, आई अप्रिशिएट, मत करो. बट इफ़ यू हैव टाइम, यू रादर, आई वुड से, गेट सम टाइम कहीं से. You manage your time wisely and put some time into the association. I was a part of BNI for a good 4 years as well, and I believe the association not only gives you the patients that you want, it also gives you the right mindset and the attitude that you want in life. अगर आपको नेटवर्किंग या कोई भी एसोसिएशंस का सिंपल चीज़ समझना है, इट्स अ वेरी सिंपल थिंग. अंडरस्टैंड कि एक कम्युनिटी है. से इफ माई डॉटर गोज टू अ पर्टिकुलर स्कूल, the school has a community. What I go over there is, I don't go over there as a dentist. I go over there as my daughter's father. So people know me like Diara's father. I'm not a dentist over there. I'm not going over there to sell myself. I'm going over there as Diara's father. The school should know me like यार दियारा खुद इतनी अच्छी लड़की है, उसके father इतने अच्छे हैं. They come over here, they help the school. So the school is benefited. If the school is benefited, they would want to love and come and get associated with you in the long run. So this is how BNI works. This is how any association works. It could be a gym subscription. It could be a Zumba dance subscription. It could be a yoga association you are attached with. Everything. This is a place where you are going and you are not paying the subscription fee just to buy health from a yoga or a Zumba class or a gym. You are paying the fee, and in return you are getting some crisp relationships being made over there. Don't go outside and start selling dentistry over there. Make friends. Make friends. People would want to come and then say, oh Jashan, तू dentist है, ओ मेरा एक tooth problem है, मैं किसी और के पास जाने के बदले तेरे पास ही आता हूँ. So this is how the associations come into the picture. Give them time and you will be benefited in the long run.
True. It's about changing the mindset as well. Like, just what is going to be your benefit in everything. Just think of it as how can you benefit them, like, and that's like something.
It's a game changer.
Yeah, it's a game changer. I love that thing. So next, coming to the challenges, like, you are taking you run an academy, doctor, where you're training the dentists to, like, get into all of marketing stuff and, like, do a lot of things for their dental clinic. What are the challenges, basic challenges you get from them, like, they are facing those challenges, and what are these, like, I would say, let's just highlight some major 3 challenges, like, majority of the dentists are facing in their dental clinics.
So the major challenge is not getting enough patients is the major challenge that many of the dentists come to me with a financial crisis, because of which turning up that patients नहीं है sir, कब तक अपने पॉकेट से घर चलाऊँगा, आई मीन मेरे पास इतना पैसा नहीं है कि मैं ऐसे सर्वाइव कर पाऊँगा. एंड दिस इज़ द बिगेस्ट चैलेंज दैट पीपल फेस. एंड it's very important to invest in marketing over here, and people say कि मेरे पास पैसा नहीं है सर, मैं marketing में पैसा कैसे invest करूँ. So in today's world we are very lucky that we don't need to invest money in marketing, we need to invest time in marketing. So if you have time, social media is free. You just go, you have to go over there, create post, making sure that you are educating the public. As I said, it's all about value addition to your customers and the pain points of your customers. So don't go outside and say change a brush once you are having a viral. That's something that everybody knows now. Create content which is unique. Create content such that people want to come to you. Create content that you build credibility. Create content so that people start seeing you. Slowly and steadily it comes to a point that you start gaining momentum. Now I have had dentists who said, I am a very professional person, I cannot do all these things. I said, okay, I'm not asking you to go and dance and do all the crazy stuff. If that's not your field, don't do it.
True.
But educate it. On the other hand, we have some dentist, I don't remember his first name, it's Gibrani, the person who makes very funny memes. I don't remember, Nooreen Kibrani or something, I don't remember his name exactly. This person creates memes. So his way of reaching the public is through creating fun joke reels. That's his way of doing it. If you're not okay doing it, that's all right. Create your own way out of it. Become educative. Reach to the world, because both these ways are going to be helpful. It's not that memes are not going to be helpful. They have a better reach as compared to education. But do something. Create visibility for yourself. And now this is free. Also, ये मत सोचना कि यार जशन मैंने 4 पोस्ट डाले, 1 लाइक मिला, मैंने 10 पोस्ट डाले, कोई आज मेरा फॉलोअर बढ़ा नहीं, क्या तुम मेरे को बोल रहे हो ये सब करो. इट्स नॉट लाइक दैट. इट टेक्स टाइम. So my first account was hacked, Instagram account. मुश्किल से सब कुछ करके मैं उस पर 1,000 फॉलोअर्स पे पहुंचा था, एंड इट गॉट हैक्ड. आई हैड ए हाई एनर्जी. आई स्टार्टेड विद द सेकेंड अकाउंट. 2 दिन में वो 500 फॉलोअर्स हो गया. देन आई लॉस्ट द मोमेंटम. देन आई लॉस्ट द मोमेंटम. फ्रॉम दैट पॉइंट टू 2 years वो सिर्फ 500 से 1,000 पहुंचा. I lost the momentum. So the mistake was not outside, it was inside. I understood that. Came back. कि burnout होने वाला है सोशल मीडिया पे. So don't try to create a post every day.
Okay.
I've had social media people, influencers, or people who train tell you that do it every day. But don't try to do it every day right from day one.
True.
You will have a burnout and then you would never want to do it. And then you would say, यार उसके तो इतने followers है, जशन इसको इतने followers है, मेरे followers क्यों नहीं? Because they were consistent. And why did they become consistent? Because there was no burnout for them. So slowly and steadily increase your pace. Understand आप कितना time दे सकते हो, and then take it ahead from there. Because once you have a good number of followers, people would want to come to you. So this is my take on marketing and social media.
Okay. The second challenge that you usually face, doctor.
The second challenge is once the patient comes in.
Yeah.
No, I will not say let this be the third challenge. Let the second challenge be phone पे ही मेरे को कॉस्टिंग पता चलना है. या तो वो लोग काउंटर पे रिसेप्शन पे
Window
है,
shopping.
आधा पाव अंदर है, आधा पाव बाहर है. दे आर इन आस्किंग अस what is the rate of an XYZ particular treatment. Now remember 2 things over here. This thing is normal. Even I have faced challenges. So what happens is a customer doesn't know the difference between one doctor and the other doctor. For them it's like every doctor is the same. For them it's like मैं यहाँ से ट्रीटमेंट करवाऊँ, वहाँ से ट्रीटमेंट कराऊँ, क्या फ़र्क पड़ता है? ट्रीटमेंट करने से मतलब है. So they are not wrong on those perspective. They are completely right. Now how you speak with them is the entire game changer. अगर आप उनको सिर्फ पैसे बोल दोगे, वो यू टर्न मार के निकल जाएंगे. बिकॉज देर इज नो वैल्यू एडेड टू द कस्टमर एज ऑफ नाउ. So I've had people who speak over the phone what is the cost, and one female had messaged us on Google a month back like what is the cost of braces, and I replied back like if you want to know the cost I can tell you about the cost, but I want to genuinely understand braces की ज़रूरत है कि नहीं. If ज़रूरत है I'll let you know about the cost. And then there was a 30-minute of pause after I sent that message. Okay. Now over Google you don't understand anything. Message deliver हुआ, read हुआ, seen हुआ, you don't know understand anything. And this was a Saturday night, somewhere around 10:30 when I got the message. After half an hour a message pops again in the same thing. Like, is the clinic open on Sunday? And I reply back saying, no, the clinic is not open on a Sunday. You let us know any other day. We'll be able to help you. And the third message is, give me an appointment for Thursday at 6:30.
Beautiful.
And this person walks into the clinic, gets her daughter along. The mother says she needs braces. The daughter says, I don't need braces. And again I'm in the same situation where I'm on the phone and texting her कि भाई ज़रूरत है तो ही करेंगे. And I understand कि okay. So I said देखिए, when she does not need it, there is no need of doing it. And let me know if you need it. This was the starting of the consultation. I did not even check her mouth. The first thing is I said क्या हो गया, like नहीं मुझे ज़रूरत नहीं लग रही. And I politely accept that.
Because she is the one who has to undergo.
I politely accept that नहीं ज़रूरत तो है, देखने तो दो. Why I don't want to even see it. ये बोल रही नहीं ज़रूरत है, फिर मैं क्यों करूँ? जरूरत ही नहीं है. Now they two are into a conversation for next 5 minutes. Then she convinces the daughter rather than me convincing both of them. One person is in my team now. She is convincing the daughter. Like, Karun gaya. Later on, you will enter into a. She is an engineer. She is doing her engineering studies right now. Later, you enter into a corporate field. Then you will feel like, ये दांत कैसे है? Now I want to go ahead and do braces. Now imagine being in a corporate world, going with braces, with outside. It becomes difficult. So rather get it done now. And the daughter said, okay, you look at it and tell me if it is required. So I have a look at it. I felt it was required. I sat down, asked her come over. I said, करना है तो ही करो बेटा. I'll tell you why it is required in you. Said these are the things which I saw in your mouth. More so, I feel the hygiene is getting compromised because of the crowding. So I don't want you in the future coming to me with hygiene related problems, cavities. So in order to do that, go for braces. The plus point is you will also look good. So you'll get aesthetic results along with functional results. Both is a win-win situation. So if you want to do it, please let me know. And the mother says, "Nay, we are doing it. Tell me the cost," and she goes ahead and does it. So the second problem is challenges over the phone and on the door. They're asking the cost, and the way you deal with it is add value to it. If you just add a cost to it, it's of no value. People run outside. So be a better human and try to help them. They would want to come to you. The third challenge is after the consultation, I'll get back to you. या थोड़ा डिस्काउंट कर दो પ્લીઝ થોડા સા દે દો કંઈક તો કરી આપો આટલું બધું ભાવ આટલું હું નહીં આપીશ. So these are finally some people who bargain. Now again, if I see the customer's perspective, are they wrong? They are not wrong. When you go outside, try to buy something from a grocery, 10 रुपए का 3 नींबू 15 का 4, I don't know what the calculation is, I'm sorry for that, but we try to save some money over there, or we look for discounts and try to buy things during the discount in order to save money. So similar is on their field as well.
General mindset.
They are trying to save money. So that's completely normal. Now remember one thing. If a person bargains, the perfect thing is he or she has seen something in you and is genuinely interested in buying. अगर वो interested नहीं होता तो वो बोलता था I'll get back to you और भाग जाता. The person is bargaining, which means you have taken that first step, you have gone through the first step. Now the person before final payment wants to save some money. Never give discounts over here. People are just trying to save some money. Don't give upfront discounts. Rather, you can do it in a different way. Like zirconia hai, PFM hai. If they ask some discount for zirconia, tell them go for PFM. You will get some lesser cost. That's not a discount, but you will save money. So if you want to save money, don't go for this product, go for this product. Your problem will be solved, but the product is different. That will save on that money. So don't give an upfront discount, rather give them an alternative which will help them save some money.
True.
So these are the 3 challenges that I have
Beautiful. What do you think, how is managing a practice? In future, what are the changes that you feel are going to happen? That certain aspects of dental clinic, they're going to change majorly, or some minor changes that you see happening in the next 10 years down the line, probably.
Probably 4 or 5 years down the line itself, I see a scanner coming into every practice. A 3D printer might join the scanner, and there are people who have their own milling machines at the clinic as well. I'm not talking about outside India. India, maybe there are people who have their own milling machines now, and they make their own crowns or onlays and stuff. So this is a major change. CBCTs coming into every clinic could also be a perfect possibility in the future. So these are the things which are going to come up in the future, and to add to it the benefit or the need of AI. artificial intelligence is something which will come to the clinics very soon. Now, if you try to run away from all these things, patients are going to run away from you. So rather accept them, hug them, understand them, learn how you can use them to your benefits, and you are going to be different from the others, and automatically you start moving ahead. So I see dentistry as not कि मैंने एक बार क्लिनिक डाल दिया सारे खर्चे बंद हो गए. No, it's not like that. It's a business. It's not an working place. It's not a place where you go to work. You are definitely working, but it's not कि आप सिर्फ पैसे लोगे घर जाओगे. That's a difference. It's an employee-employer relationship. वहाँ पे आपको पैसे लेना है, घर जाना है, all the entire money is yours. Over here, in order that you earn the same money, or in fact you can earn more money for a larger period of time, you need to give back to your dental clinic. And the best way of doing it is investing in all these technologies. So whenever they come, I don't know how long this is, because dental industry is changing a lot faster. Rubber dams are not so easily accepted today. तो ये सारी चीज़ को एक्सेप्ट करने भी डिफ़िकल्टी आएगी. आई एम नॉट सेइंग इट्स नॉट गोइंग टू बी डिफ़िकल्ट. आई एम सेइंग कि इफ़ यू एक्सेप्ट दिस चेंज यू आर गोइंग टू बी डिफरेंट. एंड आई हैव सीन people who have accepted the technology till date being different, be it Dr. Moise Khakiani, be it Dr. Niranjan Vatkar. These people, they have accepted. These people have accepted कि ओ ये चीज़ है, I need to take this. अगर ये लोग भी आज बोलते कि नहीं मैं नहीं करूँगा पोर्सिलेन विनियर्स, मोइस सर बोलते मैं बॉन्डेड रेस्टोरेशंस नहीं करूँगा, निरंजन सर बोलते कि रबर डैम मैं नहीं करूँगा, so even they would have not reached the place where they are. They love dentistry. They have accepted कि भाई this is research based dentistry. I will accept them, and that's how I will grow as a better clinician and a better educator. So take them and grow it.
Beautiful, beautiful. Coming almost to the conclusion part of it, Doctor, some advice that you would want to give to the dentist out there, like from your end, to so that that can be a help to them. And even before that, I would want you to describe your academy in a few words. Before giving the conclusion, I'd rather come to the point a little back, and I would want you to describe your academy and how do you train the dentists.
So the academy is purely on management skills for the clinicians. So when I see myself and when I see the challenges that I faced, I don't want my other clinician friends or dental friends to go through the same field and take N years to reach where I reached. This journey that I took 10 years or 12 years to reach can be done in 3 years or 4 years of time. I'm not saying it's a quick rich scheme, आज खरीदो कल पैसा पैसा माला माल, कहीं ऐसा नहीं होने वाला है, कहीं ऐसा नहीं होने वाला है. So what I'm telling you is the challenges that I have faced, I have undergone and made some particular systems in order to reduce those challenges and move ahead smoothly. And what we do in the academy is we just train other dentists with the same systems that we have created in order to sail through this journey in a very smooth way.
Beautiful, beautiful. So, coming an end to this podcast, and your advice for the dentists, any specifics or anything that you want to conclude your thoughts on, so that the listeners out there, get some takeaway points, like a few takeaway points.
So at the end, I would just love to say the first thing is, if you have reached till the end of any podcast or any video, it's a very big thing, because there are many people who drop down in the initial stage, and the main crux of anything is in the middle and then towards the end. Initially, it's just building up. So if you have stayed up to the end, you are one of the selected few people who are growing in your life. And since you are growing, you are taking action, I would like to tell about 4 things which you should invest. You should always invest in your clinic so that you keep growing, the clinic keeps growing without you thinking about it. So the first thing is marketing. इन्वेस्ट इन मार्केटिंग, बी इट मनी, बी इट टाइम. सर्च इंजन ऑप्टिमाइजेशन में टाइम नहीं लगेगा, डेफिनेटली पैसा लगेगा. तो इन्वेस्ट in marketing. If you want to grow and if you want to grow faster, you need to tell the people outside that you are the best dentist, you are the best implantologist, you are the best endodontist, whatever your field is. You need to tell it to the people. So market yourself, invest in marketing. The second thing is invest in your team. Sit with them, come on one platform. Don't have cold wars with your employees, or don't let them have cold wars in between them as well. This is not good. This is not good for you, for the clinic. Have a good culture. Have a good culture. These are the people who are going to help you. When I create this podcast, my clinic is already functioning. And why it's functioning? Because somebody is sitting over there. If I would have attitude and said कि तुम तुम्हारा देख लो, मैं मेरा देखता हूँ, so not many people would want to stay with me. Those who don't want to stay will definitely go. But I have those prime people who stay with me, who have one goal, that clinic को आगे बढ़ाना है. And therefore invest in your team, work with them, come together on the same page. Because if you want to go far, you need a team. If you want to go fast, you are ready to go alone. So that's your choice, whether you want to go far or whether you want to go fast. The third thing and the fourth thing are go hand in hand. The third thing is technology, which we spoke of, and the fourth thing is continuing dental educations or the trainings. They go hand in hand. So new technology comes into the market, you go outside, start learning, together you come and implement it, and that's how you succeed in your life. So these four things together is the perfect assimilation of the mixture, together with which you can succeed not only in the clinic but any business outside. So take this, hug them, and show them all over your social media that you do marketing. You marketing करते तो बताने की ज़रूरत नहीं है. You are a team member. You continue educating yourself, and you go outside and buy new technology as well. Don't feel ashamed कि यार मैं इतना senior हूँ, मैं अभी बाहर जाऊँगा, या मैं junior हूँ. I would be the youngest in the crowd. Come what may. If you keep learning, you would be in a much better position outside. I have seen dentists, I have seen educators who teach outside also come and learn in different courses. Yeah. So if they can do that, why can't we don't do it? So keep learning, keep educating yourself, and together with the new technologies, keep growing yourself. Otherwise बाकी लोग ग्रो हो जाएंगे एंड हम पीछे रह जाएंगे. सो आई डोंट वांट दैट टू हैपन विद यू. सो दैट वुड बी माय टेक.
Perfect. Beautiful episode, Doctor. Thank you so much for coming in. I hope you had a great experience as well. So thank you so much, Doctor.
Thank you, Jesal. The pleasure is all mine.
Thank you so much.